Okay, so this is an exercise that we're going to call it the abdominal hollow. It's a really good core stability exercise that you want to learn to incorporate, especially to help prevent back pain. But if you have back pain and you're trying to stabilize things to get out of it, then you also use it during that time. Very easy to use even when you're in pain because there's not a lot of movement involved. Abdominal hollow is an idea of you're hollowing out the abdomen, but while you're doing it, you're pushing the spine to the back of the bench or wherever it is you're lying. So I would do this at home either on the floor or I would do it in bed. You can do it in the morning, the first couple of minutes before you get out of bed. So what it's going to do is going to activate some of the core muscles that are deep inside. Specifically, one of the muscles is called transverse abdominis. So let's go ahead and show you how to do it. So with this, just stay right there. So with this, what you do is while you're laying down, you're going to form an abdominal hollow, and you're going to flatten out your back. So if somebody put their hand underneath the back, they could feel your spine pushing against there. And when you do this, you just flatten it out and you hold it. Now, the wrong way to do this is to, bring your diaphragm up, hold your breath, and not be able to talk. You're using your upper abs when that occurs. But if you make an abdominal hollow, push your spine to the back of the bench, you should be able to talk normally if you're doing it correctly. If not, you're using too much of your upper abs. And then you just hold it for anywhere from 5 to 10 seconds and then you release it. Again, you flatten it out, hold it for 5 to 10 seconds and you release it. Again, 5 to 10 seconds and you release it. The other thing, so you can think of it, the other way to think of it, so for some people it makes it a little bit easier, is to take your belly button and push it to the back of your spine. In the beginning, especially if somebody has a really hyperlordotic lumbar spine where it curves too much forward, it's very difficult for them to do this. It's also difficult for people to do this when they have a lot of back pain. But once you start it, you'll get better coordinating the right muscles so that it starts engaging those muscles and it tells your brain how to do that. And as that connection becomes more correct and more appropriate, you'll get better at doing it. So that is the abdominal hollow.